NCHCMC. Javier.
Thanks, Victor. Hi, everyone. Thanks for joining us. My name, again, is Javier Salazar. I'm the Senior Director of Programs here at Health HIV, as well as the Project Director for the AETC NCHCMC. I'd also like to welcome you and thank you for your interest in today's call. For your interest in the AETC. The purpose of today's call is to offer health centers the opportunity to gain further information on and to inquire about our capacity building opportunity, or as we call it, the HIV and Primary Care Learning Community, and this year specifically the 2012 HIV and Primary Care Learning Community. In addition to Victor, I'm joined today by our Senior Program Manager, Christine Stewart, as well as our other Senior Program Manager, Brad Ward, who is on the phone. So I'd like to start today by just reviewing the agenda for the call. We will be providing an overview of the AETC, NCHCMC, talking to you and sharing with you more about the HIV and Primary Care Learning Community, describing the selection process for health centers, provide you an overview of the actual application for the project, and give you some time to ask some questions at the end of the call. About the AETC. The AETC NCHCMC is the Health Resources and Services Administration's HIV/AIDS Bureau's major effort to reach beyond its grantees, which includes the Ryan White funded community, and to address the evolving needs and nature of HIV care and treatment within highly impacted communities of color. The AETC is funded through the Minority AIDS Initiative, as well as the AIDS Education and Training Center program. It is specifically focused on expanding organizational capacity of federally qualified health centers and lookalikes to provide care and treatment to people living with HIV. And it supports the President's National HIV/AIDS Strategy in reducing HIV-related health disparities by expanding HIV care and treatment capacity at the community level and by facilitating linkages. The AETC provides comprehensive organizational capacity building in addition to clinical training on HIV care and treatment, and it will do so for up to 30 health centers annually. Selected health centers will undergo an intensive practice redesign to develop, expand, and improve their organization-wide systems, practice processes, and outcomes to build sustainable HIV programs. A little bit more about the HIV and Primary Care Learning Community. A learning community is an established model that brings together multiple stakeholders around a common purpose and provides training, capacity building, and coaching, while also providing an opportunity for sharing knowledge across organizations. By facilitating the sharing of knowledge, the learning community generates new ideas and innovations, improves measurement of common health status indicators, and ultimately works to ensure the delivery of quality HIV care. The purpose of the HIV in Primary Care Learning Community is to increase access to comprehensive HIV primary care for racial and ethnic minority communities that are severely impacted by HIV by developing the organizational capacity of health centers that are not directly funded through the Ryan White program. This diagram visually depicts the learning community curriculum, which is designed around the patient-centered medical home model and practice redesign. We won't go into detail here, but we want to show you that it's built to support the integration of HIV into primary care practices, while also providing clinical support for the expansion of HIV care and treatment. If your health center is selected, we will present the entire curriculum in detail to you as a group. The capacity building package that is offered to each health center will include technical assistance in a variety of areas, including HIV clinical care within primary care, patient-centered medical home with HIV as a population of focus, care coordination, partnership development, practice and system redesign and patient flow, and maximizing revenue for HIV services, as well as building the business case. The curriculum will be delivered through self-paced learning, tailored on-site technical assistance, as well as utilizing distance technologies. In addition to the standard curriculum, we offer additional support. This includes the provision of clinical mentors to support clinical learning, performance improvement coaches to provide guidance during and throughout the transformation process, and twinning with Ryan-wide Part C clinics in a particular region to increase sustainability of clinical TA that is offered through the National Center, as well as with our sister regional AETC. And to support health centers in the learning community over time, we've created a virtual learning lab. This slide is a screen capture of the lab, which is a restricted access web portal that provides a safe space for staff of health centers to engage in shared learning. It includes discussion boards, live and archived webcasts, as well as discussions facilitated by our clinical and program faculty, and of course, a resource library.
Thank you for that overview, Javier. Our next presenter is Christine Stewart, the Program Manager for the AETC NCHCMC. Christine will discuss the benefits, selection process, and application process. Christine.
Thank you, Victor, and good afternoon. The expansion in access to healthcare services beginning in 2013 could mean an increase in patients for your health center, including those living with HIV. Participation in this program can help your organization be proactive and prepared to provide care and treatment to people living with HIV or expand to additional sites. Thoughtfully expanding services in a sustainable manner, we can also help learn to maximize revenue to cover costs for the addition of HIV services and connect the state and local networks to help support your new HIV services. We realize that these changes cannot be implemented successfully solely by transferring knowledge to the clinical staff. We believe that for change to be successful, we must enact changes throughout the entire organization. As Hob mentioned earlier, we do this through practice redesign based on a patient-centered medical home framework. Federal regulations will require community health centers to become recognized medical homes in the next few years, so this project aligns with transformation activities that your organization may currently be involved in or may soon engage in. While HIV is the population of focus in this project, the assistance you gain is broadly applicable and supports the entire organization. All of this will be supported by access to expert faculty, many live and archived webinars, and face-to-face workshops, as well as targeted technical assistance. Even if your organization is not selected for participation in the learning community, Health HIV can connect you to other capacity-building opportunities that we're involved with to improve your HIV services, so we do encourage you to apply. Each organization selected for the 2012 cohort should prepare for a one-year time commitment and commit to develop or expand the HIV services. We expect participation to be supported by and involve the CEO from each organization. The CEO's role is to remove barriers for staff implementing change by allowing time to access learning resources, have the willingness to restructure organizational systems, and provide other support to his staff. Each organization will be asked to appoint 2 learning leaders, one that will lead the practice transformation, the other to coordinate the learning needs of the clinical staff involved in this project. And these leaders should be senior staff that have the power to enact change within your organization. These learning leaders will be our main contacts for the project. We will also ask participating health centers to complete an organizational assessment as well as individual clinical assessments for providers participating in the project. Additionally, we might ask to have a site visit where members of the learning community come on site to your health center to meet the learning leaders, CEO, and other key staff. We expect regular communication with AETC, NCHCMC staff, and our coaches and mentors and other faculty. Lastly, we expect the change to be supported organization-wide and not solely through one department or unit. To be eligible for participation in the HIV and primary care learning community, organizations must be federally qualified health centers or health center lookalikes that are not directly funded by the Ryan White HIV/AIDS program and have a 4-year history of providing primary medical care within racial and ethnic minority communities. In the past, we've received questions around receipt of Ryan White dollars, and we would like to stress that subcontractors are eligible. Just as long as the health center is not the direct HIV/AIDS Bureau grantee, they are eligible for this project. Through our experience, we've identified other characteristics that may demonstrate that a health center is prepared to succeed in the HIV and primary care learning community. And while they're not on the screen, these characteristics include demonstrated commitment and intent to deliver HIV care and treatment services, having senior leadership in place for at least 3 years, the capacity to manage HIV patients and ability to report outcomes through electronic health records or practice management systems, and having a dedicated quality improvement staff person. Participating health centers should also be located in or near a community whose residents are at risk for or living with HIV and are predominantly racial and ethnic minorities. Preference will be given to organizations located in a geographic area with a high burden of HIV disease with relatively low resources. Additionally, the HIV/AIDS Bureau, the funder of this program, has requested that the AETC NCHCMC give particular emphasis to recruiting health centers in the 12 high-burden areas identified by the CDC. Those cities are listed on this slide. While we're charged with focusing on the 12 cities, we're recruiting organizations across the entire United States and the U.S. territories. We're interested in health centers that reach vulnerable populations like migrant workers, the homeless, transgendered individuals, and youth as part of this project. And again, I just want to stress that even though we mentioned that we're focusing, that we've asked to focus in the 12 cities, that we are recruiting organizations from the entire United States and its territories, including rural areas as well. If you have additional questions about eligibility, please visit www.nchcmc.org. Interested health centers will complete an application exploring capacity and infrastructure to provide HIV care. This application is available in 2 formats, a web-based version and a Word document fill-in form. If you choose to download the web version, we request that it be returned in Word format by email, but fax is also acceptable if you are unable to email the completed application. The application will also be available in Spanish on Monday on our website, and the website again is www.nchcmc.org. We've tried to make the application simple to complete, but we'd like to share a few notes about filling out the application. You'll need your 2010 UDS data for Section 1. I'd just like to also point out that questions requiring a narrative response are limited to 75 words in the response field unless otherwise noted, so please take that into consideration when you're crafting your responses. And a signed letter of support from your board chair is required to complete your application package. Each application will be reviewed by an external review panel representing both primary care and HIV expertise and experience. The review panel will score each application and make recommendations for selection of up to 30 health centers, Health centers selected will be notified by the beginning of the new year. And again, I just want to go over a couple of key dates. The application, again, is due November 18th, and we'll notify selected health centers by January 1st. We'll begin practice assessments on January 5th. And we'll be contacting you to schedule those. So everything will not begin on the 5th, but we just want to know that you should expect that. We'll also be bringing together the new cohort in a face-to-face meeting in Washington, D.C. in spring 2012. And the time commitment for this project will end in December 2012. I just also want to point out that we will continue to support your organization through August 2013 through our web-based resources and access to our staff here.
Thank you, Christine and Javier, for that overview of the program, the application process. And now we've reached the point where we'd like to invite you to ask questions. We know that you're very, very busy, and this is an opportunity for you to ask us directly some of your questions and concerns regarding the application process, eligibility, the benefits. This is your time, so we hope you take advantage of it. And we have a question from Rhonda. All lines are currently unmuted, Rhonda, so you may ask your call before everyone. Please go ahead.
Greetings. Thank you all for having this call. Came in about 4 minutes late, so I didn't catch the very beginning. I saw in one of the slides that it talked about sustainability, and I'm just curious as to what the plans are for helping practices to do this in a sustainable way, particularly after August of 2013.
Hi, Rhonda. This is Javier Salazar. I'll answer that. Around the focus around sustainability is not only ensuring that the learning is integrated across the organization and supported by the CEO, as well as the board, the chair of the board by their letter of support. But our goal is also to help the organization build and develop not only just linkages, but enhanced relationships with the various entities that are stakeholders in HIV in your particular state or local area, which include other clinics that are providing services, include your state AIDS director, Medicaid director, and other key state personnel and offices to not only know that your organization is expanding and seeking to provide these services, but also to have them be able to offer support and leverage any resources that they have available at the state level to help that health center continue to provide these services.
Thank you.
And one more thing, part of the capacity building also involves capacity building and technical assistance around capturing lost revenue that you may not be taking advantage of right now, and maximizing revenue.
Okay.
Thank you, Rhonda, for your question. I'd like to remind everyone that we have unmuted all of the phone lines for questions, but request that if you would like to ask a question of the presenters, please click the raise hand button so we may call on you, or alternately, the chat button, and type your question to the presenters. All chat questions will be read aloud to all participants and answered for everyone to hear. Also, if you do raise your hand and have been called on, please lower your hand so we may know that your question has been answered. And we have a question from Andrew. Andrew asks, what guidance do you offer on the relationship between the health center and the infectious disease provider in a city?
Thank you, Andrew. And every organization's relationship will be different. I think it depends on the level of HIV care that you're providing in your organization and where you want to progress to. Some people do decide to link with their infectious disease provider in the city to provide the more complex care. We, again, are supporting our organizations to learn how to take care of the low acuity patients, or, I mean, if you're already doing that, to progress further. So, again, that question will be different for, the answer for that will be different for each organization that participates in this project.
Just to add to that, we also are very interested in knowing what kind of relationship that particular organization would like to have with the infectious disease provider in their area. I hope that answered your question.
Thank you, Andrew. We appreciate you asking that question. Rhonda does have a follow-up question. She writes, will these slides be made available after the presentation today?
And yes, and you probably missed that at the beginning, but yes, the slides will be made available after the presentation. We'll post that this afternoon, as well as a recording of the presentation.
I'd like to take a moment here to remind everyone that the phones are unmuted for everyone to ask questions. If you're just listening or not asking a question at this time, please take a moment to mute your line as everyone can hear what's behind you, so we appreciate that. While we wait for more questions, let me take a quick moment to remind you that due to the high level of interest demonstrated by health centers in this capacity building opportunity, we will be hosting 2 more conference calls over the next week. Those calls are scheduled for Tuesday the 25th at 1 p.m. Eastern and Wednesday the 26th at 4 p.m. Eastern. If you've missed any part of this call, have a colleague who would be interested in learning more about this opportunity or know of another health center who could benefit from this, please let them know that these calls for health centers are being held next week. And we have a question coming in from Jennifer. Jennifer asks, is financial information required to apply to this program?
No, the HIV and Primary Care Learning Community application does not ask for any financial or budgetary information. That's not required for application or participation.
Jennifer, I hope that answers your question. And Ebony has a question. She asks, what is the responsibility of my senior staff? What is the time commitment?
So, well, thank you, Ebony. The organizations are, again, we request that each organization involves the CEO and two learning leaders. Again, those learning leaders are senior members or senior leadership within the health center, one from a clinical standpoint and one that would lead the practice transformation. We're asking that each of those health centers makes decisions on their own about who's to be involved, but the time commitments by the CEO and CFO will be consistent with other new efforts per your organization's culture. There is an expectation that the CEO will attend the orientation meeting, that face-to-face meeting that I mentioned earlier, in order to understand the full scope of the effort and have the opportunity to network with other CEOs engaged in the expansion effort.
Thank you for your question. Again, this is to remind everyone that this is an opportunity to ask questions specific to your health center or questions you might have about the application process and programs in general. So please take this opportunity to ask your questions. And we have a question from Deb. Deb asks, are tribal and urban Indian health centers eligible to participate?
Okay, yes, thanks, Victor. Yes, tribal and urban Indian health centers, which have received an FQHC designation from the Centers from CMS, Centers for Medicaid and Medicare Services, are eligible. Yes, they are eligible to participate in the learning community. Good question. Thank you. If you have any questions, please raise your hand. Rhonda asks, are there a certain number of centers that will be selected and our centers from 12 cities going to receive priority in the selection. We have the ability to select up to 30 organizations this year for the HIV and primary care learning community. As Christine explained earlier, while we're being asked to prioritize the 12 areas, we are not solely looking in the 12 cities. There is no set ratio of number of organizations in the 12 cities versus outside. We are looking for diversity in terms of geography, in terms of organization type, in terms of populations addressed, in terms of geography. So we encourage all centers that are seeking to expand their primary care to include HIV services to please apply.
And Rhonda, if I may contribute here, even if your organization is not selected for participation in the learning community, Help HIV, the lead organization behind the AETC NCHCMC, can connect you with other capacity building opportunities. So even if you are unsure about this application, please know that there are other resources available to you, and reaching out to our staff may be a way of helping you connect to those resources.
Hi, I just want to jump in verbally here for a moment. This is Rhonda again. Yeah, my concern is that I saw the eligibility about needing to have been in practice for 4 years and all of that, and I just wondered, like, for some states where maybe there's not a lot of centers who are quite at this stage of being ready to be eligible for this, like, what additional resources exist for helping them to get on that path? Because I'm anticipating with 2014, a lot of folks are going to need to be on this ship, and so just how to, I actually work with the health department, so I'm just trying to figure out how can we best help centers in our state to be prepared for 2014.
And Rhonda, I mean, that's something we can chat after this call, because that sounds like it might be a specific question that you might have. And on the next slide, we'll put up my contact information as well as my colleague Brad Ward, so we can chat a little bit more about that.
Great, thank you.
Rhonda, this is Victor. You are speaking our language. We are here in our capacity at the AETC, as well as technical assistance providers, to help health centers prepare themselves for the integration of services in advance of 2014. So certainly we appreciate the fact that you see the same train coming down the same track. So thank you.
I'll ask one more question if I can. Along that same lines, I know that there's concern with the ACA being implemented, fully in 2014, that there's not going to be enough providers, like new providers, coming on the scene that are prepared to really handle the capacity that we're expecting to come with, the full implementation of this. And I'm wondering if there's anything that your center is doing or thinking about in terms of tapping medical schools and really helping to help them be prepared as well.
Well, as the AETC, we're not specifically tasked with tapping medical schools per se. We are linked with the regional network, a network of regional AIDS education and training centers that are tied to medical schools and schools of public health around the country, who are working to further that cause. Health HIV is also involved in other types of workforce efforts to build capacity beyond what we're doing as part of the HIV and primary care learning community. And it's those kinds of opportunities, for example, that we are able to tap different health centers into if they don't specifically, if they're not selected for this opportunity or qualify for this opportunity.
And I'd just like to piggyback on Javier's response. I mean, and while the center is not specifically aimed at at increasing the number of providers through medical school. If your phone, just to let everybody know, your phones are all unmuted, so if you're not currently speaking, can you please mute your phone on your end? Thank you. Then sorry, to further respond to your question, Rhonda, we are charged with expanding the workforce. That's one of the things that the center is set out to do. We all understand that increase the number of people that might be coming to health center doors. So this center is set out to specifically address the workforce issues that are already here.
Question coming in from Trina. Trina asks, does the program provide funding to health centers?
There's a minimal amount of resources that are included to actually provide actual cash funding to health centers. We will provide support, for example, in the form of stipends, et cetera, to participate in maybe some medical conferences for clinical staff, for example, or to participate in a additional workshop that the AETC may set up. We do, however, provide all financial support for travel, for all the training, for the mentoring, for the TA, and all of those related costs throughout the program. The costs that the health center will incur are those in terms of time, ensuring that the staff have adequate time to participate in the assessments and engaging in the various training, whether it be through the webinars, through the self-paced learning, or through actual on-site technical assistance.
Thank you, Trina. I hope that answers your question.
I have one more question. I'm sorry, I don't mean to monopolize the conversation, but I'm wondering, you also stated in the eligibility requirements that they had to be either FQHCs or lookalikes, and I'm wondering if there's any opportunity for those practices or centers that aren't that. Would that fall to those other resources for preparation that you referred to?
For the other resources, yes. If this project is specifically targeted to FQHCs and lookalikes, health centers, but for any other organization type or practice that is seeking to develop the capabilities of their providers and staff, yes, those other resources would be available to them.
Well, not seeing any more questions, I would like to take a moment to thank you all for participating on today's web conference. If you have questions about this opportunity, or if you know of someone in your health center who would be interested in learning more about this program, please have them contact Brad Ward or Christine Stewart, our two program managers. Their information is listed here on your screen for your convenience. We'd also like to encourage you to visit the NCHCMC website. We do have a frequently asked question page where many of the questions you may have already been answered, as well as links to the eligibility, benefits, selection process, and the application forms themselves. Finally, I would like to remind you all that following this presentation, there will be an evaluation form. Please take a moment to complete this brief form. It will allow us to improve and this process for future years, and hopefully in the future provide you with more relevant information for you and your health center colleagues. Thank you all for your participation this afternoon. If you continue to have any questions, please reach out to Christine or Brad, and have a great day, a great afternoon, and a great weekend.
Thank you.